The next step is folding and storing the NASG. Folding the NASG correctly is key to being able to unfold it and apply it quickly on the next patient in shock. So we start with segment 1. You fold as you're seeing we are doing in the video. 2, and fold it. Then we go to segment 3 and fold it the same way. Then now we bring segment 1 to segment 2, and then both 1 and 2 to segment 3. Okay. Then we roll it over, and then they go to segment 5 and 6. Then 4 will cover. We fold segment 4, then it will cover over the other segments. Okay. Then we'll bring the ball, which is segment 5, and then finally segment 6. After you have folded the NASG, it should be like a bag. Easy to carry, easy to move around, easy to unfold for the next patient in shock.